Hi, I'm Dr. Gemma Pearce and this is Dr. Sally Pezaro. We both work at Coventry University and we are doing some work on Ehlers Danlos Syndrome and maternity care.
Really excited to be here today at the Pint of Science event. Really hope we can engage the midwives and the public in this really important work. Hello everybody, thank you for coming along today. I'm Dr. Sally Pezaro from Coventry University and I'm here to introduce to you a topic that is quite unusual in that it's Ehlers Danlos Syndrome and how that affects people who are childbearing. So bear with me, we've got an interactive session and hopefully you'll go away learning something you didn't know before. So this is me and this is the team. So this is EDS maternity and you can follow that hashtag on social media if you want to find out about our work going forward. So there's me here on the right, Sally Pezaro, we've got Dr. Gemma Pearce and Dr. Emma Reinhold, and we come from 3 different backgrounds. So I'm a midwife by background, Gemma Pearce is a psychologist, and Emma Reinhold is a GP. And we came together because we each had a different experience of Ehlers Danlos Syndrome, as in I knew nothing about it, and maternity, which I was the expert in because I was the midwife. And what we were finding was that people were having babies with Ehlers Danlos Syndrome and coming out more disabled, with trauma, with issues that were obviously in need of address. And people were talking about these issues and not putting the story together. So we decided that something needed to be done. We were identifying that there was a problem and we decided to come and put our heads together really and see if there was something we could do in terms of research to make things better for childbearing women with Ehlers Danlos Syndrome. So I'm going to take you through that journey and hopefully you'll learn a bit about Ehlers Danlos Syndrome. So a zebra. Why do I have a zebra in front of you? Well, medical students, when they are taught in medical school, are generally told if you hear hooves, expect horses, not zebras. So in other words, if you see symptoms, think about the obvious rather than the rare conditions. Think about what it's most likely to be rather than something obscure and exotic. But actually, Ehlers Danlos Syndrome was seen as the rare condition. It was something you did need to look for the zebra. You needed to look for the Ehlers Danlos Syndrome. Now, there were 14 types of Ehlers Danlos Syndrome, and it's a genetic condition, so it's, you get it from hereditary from your mother, father, whoever. So 14 types, and many of them are indeed rare. But hypermobile Ehlers Danlos Syndrome, which is what I'm going to introduce you today, we no longer think is rare. So that's what we're trying to get the message out, that hypermobile Ehlers Danlos Syndrome is not actually as rare as you think. And it affects more women than men and represents about 80 to 90% of all Ehlers Danlos Syndrome cases, okay? So it's around that common. But on average, unfortunately, it takes about 16 years for someone to be diagnosed with Ehlers Danlos Syndrome, from when they first start to notice things, see symptoms, etc. That's when they start to see it, and then 16 years later, on average, is when they get diagnosed, which means a lot of problems happen in the meantime. Now, it affects each and every person differently, but there are some sort of known factors across all types, but it affects all connective tissues throughout the body. So that's connective tissue is literally everywhere in your body. And because this is a syndrome that affects connective tissues, it could affect each and every symptom and system with it in your body. So that's something just to bear in mind, okay? So that's the zebra. Now there are a couple of things that are characteristics shared among a few types of Ehlers Danlos Syndrome. And one of them is hypermobility in the joints. So hypermobile joints are one of the things that are shared across a few Ehlers Danlos Syndrome types. I myself am very much not hypermobile, so I can never demonstrate this. I have to use pictures. And also skin hyperextensibility or fragility. So fragile skin or stretchy skin, okay, is often exhibited. So I just want to test with you now. Again, I can't do this myself because I do not have hypermobile Ehlers Danlos Syndrome. But if you can do this, this is the rubber glove sign. So this is pulling this part of your hand, at the back of your hand, the skin, and seeing if you can make the rubber glove sign there. Can anyone replicate that image with their own hand? Does anyone have that? Are we? Okay, 2 people back there. Okay, that's quite good. 3 people. That's 3 people in a room of how many are we? Maybe 20, 30 people? Okay. Now let's see how hypermobile you are. So again, I can't do this because I'm not hypermobile. But what we're going to do here is go through a series of movements. You will get 1 point for each move you can do, and you will test how hypermobile you are. So first of all, stand up, everybody please, if you are able. And can you touch the floor and put your hands flat on the floor? This is about as far as I can go. Can anyone put their hands flat on the floor? Put your hand up if you can. Okay, so are these the same people that had, some of the same people that had the gloves on before? We've got about 4 or 5 people. Okay, well done. I'm impressed. Right, the next one, can we go to the elbow? So you want to put your elbow out and see if you, I can't again, but if you can hyperextend, or if your elbow hyperextends. Anybody? If it hyperextends, you get 1 point, another point. It's like the Eurovision Song Contest all again, isn't it? Nil point, un point. Okay, so number 3, now you're going to have to sit down again and put your leg up, 1 leg up on the person next to you's knee, and see if your knee hyperextends. So if it extends upwards, if your ankle comes upwards slightly, your knee is extended. Anybody? Okay, a few people. Switch legs, you get 1 point for that leg. Another point for the other leg. Anybody with both legs like that? Okay. Let's do the other arm, because we only did 1 arm before with the whole hyper thing. Yeah? Anyone another point there? Okay. Now we have to do our hands. So this is the thumb. Does the thumb touch your wrist? How many people? Okay. And the other hand? Again, I can't do it. Okay, so that's 1 point each hand. And then lastly, you've got the 90-degree angle on the finger. So again, no. Was anyone keeping scores? We had a few people over here consistently put their hands up. So we have some hypermobile people. Is anyone really not hypermobile like me? Yes. Non-bendy people. So that's just a little assessment about how you would assess hypermobility, joint hypermobility. So now on your tables, you will see that you have some lollipop sticks and some elastic bands and some crude examples of bones and joints and ligaments and tendons which stretch or do not stretch. Now, people with hypermobile Ehlers Danlos syndrome, they often dislocate some of their joints. And this is because the tendons and the ligaments and those connective tissues don't really hold things together well. They're either too loose and everything goes floppy about, or they're holding too many things, or the weight's too much and they can't hold on to things. So I want you to play about with those for just a minute or so. Try out different elastic bands, thick ones, thin ones, short ones, long ones, so that you can get the idea of if your joints are held together with these floppy tendons, ligaments, connective tissues, how might your joints not hold together? So how might they stay together? How might they fall apart? So in a regular person like me, I never dislocate anything. What would my tendons look like? Which elastic band would that represent? And with someone with Ehlers Danlos syndrome, where the connective tissues are affected and everything's hypermobile and dislocating, what would their elastic bands look like? Get a bit artsy and crafty. I've only got 1 pint glass prize for the best question rather than the best creative artwork, but so that's just to give you an idea about how joints and tendons work and how the more elastic type won't hold things together. Things will fall apart or be too tight and held together properly. So then we started to look at, okay, that's what we know about Ehlers Danlos syndrome. Let's look at what we know about pregnancy and how that might affect things. So hormones. We know hormones are around in pregnancy. They help everything to grow. They help prep the mother for lactation, breastfeeding, They enlarge things, they stretch things, they relax things. Because things need to grow, so everything needs to be relaxed. Now, if you look at those elastic bands and on the joints, what's happening when you get a lax ligament or piece of connective tissue, and then you've got these hormones into play when you're having a baby and everything is even more relaxed to let the baby grow, what do we think is going to happen to the pregnant mother potentially having these hormones in place with Ehlers Danlos syndrome? Things might get worse, mightn't they? So what else happens in pregnancy? So you've got added weight. So remember I said, you know, with some joints, if too much weight's put on them, if too much strain, that could cause pressure and pressure to dislocate. With the pregnant mother, we've got breast tissue, we've got stored fat, we've got the actual baby, the increased blood supply, a bigger uterus, placenta, and the fluids involved. So you've got all of that extra weight putting on the mother and her pregnant body. You've also got increased cardiac output, so you've got extra blood volume, about 40% extra blood volume on board. You've got increased cardiac output, so the blood is having to pump harder, faster, the heart, etc. You've got that stress. And then increased oxygen input is needed, so they're breathing more regularly, more frequently to kind of cope with that pregnancy as well. And so what tends to happen is that they are being linked. Ehlers Danlos syndrome is currently being linked with a number of obstetric complications. Now I will stress they're just being linked at the moment rather than proven, but because of these things happening within the pregnancy and happening within Ehlers Danlos syndrome, when things are coming to pregnancy and birth, complications are arising, and it's further research needed to really hone in on what those are and what's really required. So we wanted to talk, we wanted to change things. We knew these things were happening, they were all anecdotal, they were what women were telling us, and they were what we knew from a midwifery perspective, from a psychology perspective, a GP's perspective, and also just from what women were telling us. So the first thing we did was to produce a review of care considerations, basically. So we got all the evidence together, and we put that into a paper for people to use and take to their GPs, using their pregnancies. Midwives were using it to inform their practice, and that was what we currently knew about the situation. But then we wanted to learn more. So after we produced that review of care considerations, we wanted to talk to the women involved. So we wanted to know, okay, you've had a baby, you've got Ehlers Danlos syndrome, what was it like? Tell us your story. So what we did was we put out a tweet to say, does anyone want to tell us their story? Bearing in mind this would be just typing to me on Skype their story, so they wouldn't have to pick up a phone or come and meet me in person if they were experiencing symptoms of, you know, Ehlers Danlos syndrome. After one tweet went out, we got over 200 people saying, me, I want to tell you my story, I want to tell you my story. Unfortunately, with that many people coming forward and that much data, it would just be too much to deal with. So we capped the limit at 40 people, and those 40 women told me exactly how they experienced childbearing with Ehlers Danlos syndrome, and we learned a lot from those women, and we're hopefully going to publish those results soon so we can share more with you. And I will share more with you now. So first of all, they said healthcare professionals were just panicked when things went wrong, when things were unexpectedly occurring. They panicked, they didn't know what to do, and that's actually really stressful for a midwife or a healthcare professional working in maternity services. You know, we go through protocols, we know what to do. When you're faced with something you don't know much about, you panic, and I definitely did when I didn't know about Ehlers Danlos syndrome. I didn't know how to care for this group of women. So that's what the women were telling us, they noticed that. And also, they were really unknowledgeable. They didn't know about it, they'd not heard about it before, they couldn't diagnose it, they were kind of dismissive of concerns, dismissive of what was happening, and we already know what's happening with the lack of diagnosis. So in pregnancy, maternity care staff were even less prepared, really, because it's not their speciality in the first place. And often their symptoms got worse, whether that was symptoms of pregnancy or symptoms of Ehlers Danlos syndrome. Throughout pregnancy, things were generally exacerbated. And because of the poor treatment they were experiencing, basically they said, you know, these healthcare professionals don't know how to help me, they don't know anything about my condition, they're treating me like I don't matter really, discrediting everything I'm saying, I'm just going to disconnect. And they literally stopped engaging with services because people were not listening to them and didn't know how to care for them effectively. And then obviously there's the trauma, the depression and the anxiety that goes with experiencing a traumatic event, not being listened to, not having the maternity care that you require, and that high quality care that every woman's entitled to. And actually, in some cases, it was so bad that some people said they would never have another baby again because their experience was so bad. Now that is really tragic and really kind of one of the reasons we are looking to do better and looking to learn more about this. A lot of the time when anaesthetic was given and analgesia, so pain relief and anaesthetic just often didn't work for these people, and they know that from going to the dentist. They say, you know, anaesthetic just doesn't work on me. So during childbearing, when we were giving anaesthetics or giving analgesia, they were saying, it's not working, it's not working. And what was happening was the healthcare professional was saying, well, of course it's working. I've given you a whole full dose. Don't tell me it's not working. Of course it is. And it's that whole miscommunication, not understanding or believing what the person is telling you that was really causing more trauma for those people. And then people were generally having these experiences in the actual birth of their babies where they would have their uterus contract for periods of days, and some people were describing weeks where their uterus would be irritable, contracting on and off for days and days, and no baby would arrive. And then all of a sudden, out of almost nowhere, the baby would shoot out very, very fast. And so when they were in these early stages of labour, their cervix wasn't dilating to let the baby out, but they were telling professionals, you know, having these contractions. And the professionals were saying, well, you're not dilating, you're not in labour. And then all of a sudden, the mother would be shocked, the maternity professionals would be shocked, and the baby would be here. And again, they weren't being believed. So that was one of the other things that came about. So now I'm going to share some of the quotes that the women told us about. Now there are unicorns on your table, and these carry, on the wings of unicorns, are carried the voices of these women who bravely told us their stories. So what I want to do one by one is I want you to fly your unicorn towards me. So yours is broken, so we'll have yours first. Thank you. So this woman said, it was refreshing when staff were aware of Ehlers Danlos Syndrome, but many of us are used to not being believed. So this woman actually found someone who was aware of Ehlers Danlos Syndrome, a healthcare professional, and that was a relief for her. But she's well aware that people were not used to being believed. So that's one. Can I have someone else fly me a unicorn, please? Go, you look excited. Woo! Thank you. Okay, so this lady said, during pregnancy, I felt the healthiest I had ever been. And so that's just saying to you really that although these findings are generalised, there are always exceptions to the rule. And for this one person, during pregnancy, she felt better with Ehlers Danlos Syndrome. Can I have someone else fly me a unicorn, please? Whee! Oh. So this person said, oh, this is a quote. This is actually my favourite one. You are not hypermobile because you can't touch the floor. So remember we got you to all touch the floor because we were testing your hypermobility. This was a healthcare professional that refused to believe that someone had Ehlers Danlos Syndrome because they couldn't touch the floor. The punchline is this person was 8 months pregnant. So I don't know how they're going to touch the floor. Okay, next unicorn, please. Oh, you've got quite a way to go. Oh, nearly impaled by a unicorn. Thank you very much, Lee. Okay, so this was a lady who said 10 centimetres, fully dilated, just 1.5 hours after being 1 to 2 centimetres dilated. So this was just explaining how a quick birth had occurred following a rather long latent phase of labour. Unicorn. Oh, you're getting it tonight. Okay, this lady said, I popped my hip out when I sneezed. I was having walking issues. So this is literally someone who's, when they're sneezing, their hip joint dislocates every time they're sneezing. That's pretty severe. I can't imagine what that feels like. But it must be quite problematic during pregnancy, I imagine. Any more unicorns? One. It's too far away to fly. Woo-hoo. Thank you. So I think this is the last one. This is someone that said, I didn't have any other children because I was too scared. So again, that's really the heartbreaking thing. People were literally limiting their families because they couldn't face going through another traumatic experience. And this is really something we have to change, and something we're working towards, so that more people can have a positive experience of childbirth and childbearing with long-term conditions such as this. So I'm gathering that's all the unicorns done. One more, please. Last unicorn. Whoa. Oh, thank you. Oh, safe. That's good. That's good. I was in agony. I could feel burning and ripping. This was unfortunately someone who had some stitching being done and some operations down on her lady parts, and the anaesthetic wasn't working, the pain relief wasn't working, and she could feel everything, and she was having surgery at the time, and obviously really traumatizing. I can't even imagine how that must have made that woman feel. But I think it's really important that we share these stories via the wings of unicorns to get the message out to you guys in the public. Is anyone a healthcare professional? You are. Where do you work, or what profession?
We're med students.
Med students. So this is really important, yes? Are you going to go back and tell people all about it?
Everyone we meet.
Yes! That's what I'm after. Is anyone else kind of getting anything from this, that they're thinking, I'm going to take this back into my life in some way, and it's going to make a change for me? Yeah, we've got some nodding heads. I hope so, because something has to change, and we're really working towards a positive outcome here. So after the flying unicorns, I'll leave you with one final message, and this is: if you can't connect the issues, please think connective tissues. Because it could be that hypermobile Ehlers Danlos syndrome, or a different type of Ehlers Danlos syndrome, is the zebra you are looking for, or the pony, or the unicorn in our case. So that's the end of my presentation. Please get in touch and follow us on social media. You can follow the hashtag for our ongoing projects. We are looking to do some international online surveys where we can collect a lot more data from a lot more people. That includes healthcare professionals working in maternity services, and women with hypermobile Ehlers Danlos syndrome with experience of childbearing. And when we can get those larger numbers, then hopefully we can learn a lot more and make a difference for more women. So thank you very much for engaging with me today. Any questions, please? They'd be offered those complementary therapies as any other woman would be, if they're available in their trust. One of the difficulties with me taking questions in any of these arenas is, the answer often is, we don't have the answers yet, because this is at such an early stage. Nothing's really been done. There's a few case studies and a few studies linking childbearing with certain things, but we're just at the beginning of this, really. So everyone's saying, you need to look at this, you need to look at that, but really they're new research questions for us to go and understand. And it might be that they're offered those complementary therapies, but are they effective in the same way as regular people having babies? And that's something that will need to be answered through research. But I don't see why not. They would access it like any other pregnant woman. It was more subjective. A lot of these people we interviewed, we asked them what were their comorbidities at the time. And a lot of them said that they had a multitude of comorbidities as well as the Ehlers Danlos syndrome. And because this affects connective tissues throughout the body, that's not really surprising that they're experiencing a lot of other things. And we have no idea what connects to what. So it could be that another health condition was making her feel well at the time, rather than the Ehlers Danlos syndrome making her feel worse. We don't know that. And really, we include that because that wasn't the majority of cases. That was the unique case. And I don't want to tell you that everybody with EDS has a terrible experience, because clearly there are exceptions to the rule. And I think that quotation was to highlight that, really, that everybody is different and nobody should be treated the same. Yes. Yes, because I have to say, my other two co-researchers, they won't mind me saying, they both have Ehlers Danlos syndrome. I do not. And I'm the one standing up usually in front of midwives trying to explain, which is why I use a lot of pictures and a lot of you doing the work. Because weirdly enough, every participation event or presentation I do, there is always at least 2 people who say, I have Ehlers Danlos Syndrome, or I'm hypermobile. And so I usually get them to do the demonstrations, because I'm not even joking, I'm really not, I'm the least bendy person, basically. So yes, it is hard. It's a genetic condition, but there is no genetic test to kind of say, yes, you have it or no, you don't. So the difficulty at the moment is that diagnosis is done through several tests like that, plus a family history, plus an overall clinical picture of things. And there are very few specialists that can really diagnose you very well. I would point you all to the Ehlers Danlos Syndrome toolkit by the RCGPs, which has a load of toolkit stuff available for you to learn more about this. But diagnosis, I wouldn't feel comfortable diagnosing someone with EDS. It's out of my clinical practice, scope of clinical practice, and I'm sure there's lots of other people that feel like that. But I like to know something about it so that I can refer to that specialism. Because, yeah, diagnosis is really, really, really difficult, actually, I think, for a lot of people. I think the problem is because it's considered a rare condition at the moment still, really, it's taken on board with a number of rare conditions, and also under the umbrella of a long-term condition, because it's something some people live with. I think with our next publication, we are going to publish that we think the prevalence is a lot higher. Once we raise the profile of that and say, actually, this is something that needs to be taught separately or given special attention to, more funding to, because it's more frequent than you think, I think at that point we can get it into the curriculum and get it into nurse training and just general medical training. That's the first hurdle. I think, again, because it affects every person differently, you need to ask that person how Ehlers Danlos Syndrome affects them. Then you can start to see, okay, now we're factoring in a pregnancy. How is that potentially going to affect you and how you experience Ehlers Danlos Syndrome? There is our paper up here, Hypermobile Ehlers Danlos Syndrome, during pregnancy, birth and beyond, which the British Journal of Midwifery have kindly made open access, so free to the public and all healthcare professionals to download. And that's us putting the evidence together with what we know in terms of midwifery knowledge to sort of give you some hints and tips. But I wouldn't say that's a comprehensive list of everything we can possibly do. I think with more research we can find out better ways to support this group of women.
I have to give you this pint glass
yeah?
to sort of...
Oh, there were so many questions.
The best question.
I think I have to give it to the medics, because you're the people potentially who could have the most impact on women with hypermobile Ehlers Danlos Syndrome. So I'm going to give you that to share.
Thank you.
Okay?
Thank you.
Thank you very much.
Thank you.